Hundreds of thousands of white flags blow in the wind on the National Mall in Washington, D.C. Each flag marks an American life robbed by COVID-19. Many of those who perished were parents. According to a new study published in the journal Pediatrics, more than 140,000 American children under the age of 18 lost a parent or primary caregiver to the virus. That's roughly 1 in 500 children. In a statement, the lead author of the study said children facing orphanhood as a result of COVID is a hidden global pandemic that has sadly not spared the United States. The losses are not equally distributed.
People of color have disproportionately died of COVID-19. As a result, it is the children of minorities that are the most severely impacted by the sudden death of a parent or primary caregiver.
Roughly 65% of the children who lost a loved one were of a racial or ethnic background. Mental health experts say the trauma of losing a parent prematurely can have far-reaching consequences.
We know that the more adverse experiences children have, the more likely they are to develop problems not only in their mental health, but also their physical health, their relationship with others, how they view the world.
Dr. Alfie Breland Noble, founder of Acoma Project, a mental health nonprofit that mainly services people of color, says it's important for trusted adults in the child's life to reach out.
We always want to tell young people and reassure them the emotions that you feel are valid. Please express the emotions, because the problems come when you stuff them down and you don't allow them to emerge. They're going to come out in other ways that are often unhealthy.
Gerwich says there are plenty of resources available to help kids deal with grief and trauma, but more needs to be done to improve access to care.
We truly have to devote resources to the mental health side of this pandemic. Those challenges are going to extend far beyond this virus.
Breland Noble would like to see a wider discussion about mental health to help destigmatize those who seek care.
I really would love for us to have a national conversation about grief so that we can really normalize it, because it is a regular, necessary, important, and unyielding part of life. We are all going to grieve something.
She says the key for kids is to be allowed to grieve in their own way and time, and be reassured of their safety and security despite the loss. Karina Huber, CGTN, New York.